and welcome to the Texas Annual Conference, clergy and family members, to the 2024 Group Health Benefits High Deductible PPO Plan webinar. I'm Robert Besser, your conference treasurer and your benefits officer, and we have a few other members of the Center for Connection and Resources that are here with us this afternoon, and I'll ask them to turn on their cameras as I briefly introduce each of them. So we have with us today our Fiscal and Benefits Controller, Mark Helms, Marianella Morales, our Senior Group Health Benefits Specialist, our HIPAA Privacy Officer and Wellness Program Coordinator, Patricia Goforth Rakes, who is our Senior Pensions and Retiree Health Benefits Specialist and Walking Program Coordinator, Ryan Johnson, who is with, he was a senior partner with Alira, and Alira is our TAC Group Health Benefits Consultant team. And then also with him is Carrie Moore Miranda, who's also with Alira, with our Group Health Benefits Consultant team. I am going to invite Ryan to begin the presentation this afternoon. Ryan, welcome, and we're glad you're here.
Good afternoon. Thank you all for having me today. As Robert mentioned a moment ago, my name is Ryan Johnson. I work with the Lara Group, and so we are a consulting firm that works for TAC. And today we are going to talk about your high deductible plan and help you understand a little bit better about what that means with that plan design, how a health savings account works and how it pairs with your high deductible plan. And maybe some common misinterpretations or misconceptions about what that plan looks like. And we'll also show a few different financial examples of if you were to enroll in the high deductible plan versus the standard PPO plan, how the money works on that. So hopefully this will be beneficial for you all to understand a bit more about making a good decision as your open enrollment period does start tomorrow. So to start over here, you can see that the high deductible plan provides access to United Healthcare's broad Choice Plus PPO network. So that's what allows you to have your in-network discounts where you'll have in-network providers, whether it's a provider of doctor or a hospital. If you enroll in a high deductible plan, you have the opportunity to open a health savings account as well. And that is a debit account that allows you to pay for your out-of-pocket expenses related to your medical plan. You also can use it for your dental and vision, which I'll cover in a moment. One key item to be aware of is your high deductible plan has the same network and offers the same coverage as your standard PPO plan. Okay, I'll say that again. Your high deductible plan has the same network, same coverage, meaning the same covered medical procedures, same pharmacy drug list. It's all the same. The real difference between your high deductible plan and your standard PPO is the cost share. So that's the difference in what you're going to pay in premiums up front versus what you pay when you go in for care. So it's a really important distinction to understand between these. And one of the things you'll see in the examples that we'll cover is the standard PPO plan is about twice as expensive as the high deductible plan. So you might really want to put some pen to paper and look at the math and figure out which of these plans works best for you. So moving through here, a health savings account overview. Here's some general information. So in order to participate in a health savings account, you have to be enrolled in a high deductible plan. And this is governed by the IRS of what actually qualifies for a high deductible plan. It essentially means that you don't have any copays to go in for care. You have a minimum deductible that you have to meet until your plan pays for anything. So it is governed by the IRS, and the IRS says if you're enrolled in the high deductible plan, you can then open a health savings account. And a health savings account is a special tax advantage account that allows you to put aside tax-free money. And the money that goes in there is you get a tax deduction when it goes in. You can earn interest as well. That's tax-free, and all withdrawals that you make throughout the account are going to be tax-free, provided that there were qualified expenses, which I'll cover again. At the end of the plan year, one of the unique things about this, a lot of people think of a flexible spending account, which you're pretty familiar with, which is somewhat similar, where you put aside pre-tax dollars to pay for your qualified expenses. The big difference in an HSA is this money, if you don't use it, it will roll over from 24 into 25 and 25 to 26. So you can actually build up a value within your health savings account that continues to build over the next 5, 10, 15, 20 years. You own the health savings account. So you keep the funds that are in your health savings account, whether you change jobs, change health plans, whatever may happen to you, that those HSA dollars that you put in there are always your dollars, and they'll always be available to you. So you can withdraw money directly from your HSA using a debit card, or you could leave that money in the HSA account and just let that build and accrue over time. Now you have the flexibility to open a health savings account wherever you like. We will and have sent out some information in the past about HSA Bank as an option. The previous slide did note HSA Bank as a debit card provider, but you could use, Bank of America, Wells Fargo, wherever you want to open a HSA, you can use that banking provider, and you will just have designated dollars in a qualified health savings account program for you. For 2024, the tax year contributions have actually increased. So in 23, this year, we can contribute up to $38.50 for an employee only. For 24, you can contribute up to $4,150, again, tax-free, if you're enrolled in a single coverage high deductible plan. If you're enrolling yourself plus dependents, so that would be an employee plus spouse, plus children, plus family, the maximum contribution amount for 24 is $8,300. If you're over the age of 55, you also can add an additional $1,000 into your health savings account. So who's eligible to participate in a health savings account? Per the IRS guidelines, you have to be covered under an HSA qualified HDHP, as I mentioned before. So your HDHP at TAC is a qualified high deductible plan. So you have to be enrolled in one of those plans. You or your spouse are not covered by a non-HSA plan. So you can't be enrolled in a copay plan at another employer. Or if your spouse is enrolled in the TAC plan, plus they're enrolled in a copay plan elsewhere, that would disqualify that person for the additional HSA funding. You cannot be enrolled in Medicare or TRICARE. Those also are plans that have copays. So those are not qualified high deductible plans, which means you're not able to contribute to a health savings account. You can't be claimed as a dependent on someone else's tax return. You cannot receive VA benefits within the past 3 months to continue to add money to an HSA. And you or your spouse, you cannot be contributing to a healthcare flexible spending account. Again, that might be through another employer. If you're uncertain, you can check with your CPA, but it's ultimately your responsibility to determine if you're HSA eligible or not. If you have some questions, you can check with your benefit team at TAC. We can help them answer some questions on your eligibility, but ultimately it is your determination if you're eligible for the HSA. Now, enrolling in the high deductible plan is separate, as I mentioned before. This just revolves around, are you able to put aside those pre-tax dollars to pay for your expenses? So as we talk about contributions, I mentioned a moment ago the maximum allowable amount. So again, that was $4,150 for an employee only and $8,300 for a family. All of those funds that you're putting in there are tax deductible. Now, you don't have to fund up to those limits. Those are just the maximum amounts that you can do. And you can fund your HSA at any time throughout the year. You could front end load it. You could put a lot of money in January and February if you wanted to, or you could do an equal amount throughout the year. You could say, I'm going to do, $100 a month, and it's going to be $1,200 that you set aside every single month. And that would just be a way that you are moving money from your checking account that you're then depositing into your HSA account. At the end of the year, when you are doing your taxes, there are some tax forms. There's a tax form 8889 that you'll file that designates how much money you put aside into your HSA. And that's what allows you to get those pre-tax benefits, or the reduction on your taxable income when you file your taxes. If you are with one of the churches that maybe a little bit of a larger population, you can check with them to see if they're able to do a pre-tax payroll deduction directly from your paycheck to your health savings account bank. The link down below shows you how to set up a health savings account. Again, I mentioned that you can use whatever banking account that you maybe already are using, or you can choose to use HSA Bank. And there's a link in here in the materials that you're welcome to use HSA Bank if you like to. Just like you'd have with any other sort of savings account, there are some fees that might be a couple or a few dollars per month for your health savings account, unless or until you hit a threshold. Once your deposits exceed a certain dollar amount, you're then able to usually waive those fees. So you'll have to check with your actual bank to see what their fee structure is. Oftentimes, as your account balance grows, many of these HSA Bank providers will also allow you to have some investment options. So you could actually invest your money instead of leaving it in a savings account that has a very minimal return on investment. You could actually direct these into some other investment vehicles if you wanted to. Again, this is all your money. You can do with it what you want. What you're doing when you're putting something into an HSA is you're just designating some tax-free benefits. And what you're doing is you are saying, I'm going to use this money for qualified expenses. So your distributions stay tax-free as long as the distributions are used for your qualified medical expenses defined by IRS code 213D. These are things that you can Google HSA qualified expenses and you'll find some publications online. But generally we're talking about physician and hospital charges, lab, x-rays, medications. If you're getting any durable medical equipment, you also can use it for medical. In addition to medical, you're also your dental and vision expenses. There are some other items that you can use it for: acupuncture, smoking cessation, step therapy. So a lot of different covered allowable expenses in there. Now, as long as you use it for qualified expenses, you're going to continue to get those tax benefits. If you use your health savings account dollars for something that's not qualified, you can see a note down here, is you will have to pay income taxes on the money that you previously avoided income taxes on. And you'll also need to pay a 20% penalty, okay? So if you're putting aside money for money into your HSA, that's not really something that you want to deem for Christmas gifts, right? Unless you're getting your kids eyeglasses. And if you're getting them eyeglasses for Christmas, they might not be too happy about that as it is. So maybe really just put aside what you think you're going to need to spend on your healthcare dollars. After you exceed age 65, you can actually start using this money for your Medicare premiums. So again, this money is always your money, and you can use it for anything that's health related. And once you go over 65, you don't have that penalty on a go forward basis. Moving forward here. So this is a grid showing for 2024, the cost for you to enroll in the TAC health plans. So you can see on the left, we have the high deductible health plan. And this is a percentage of your earnings that you would pay to enroll in the high deductible plan is 3.2125 versus the standard PPO, it's 6.75. So you can see it's a little bit more than double the cost for you to enroll in the standard PPO plan. What we did is actually we created a discount for you to enroll in the high deductible plan for 24. If you're enrolling yourself plus your spouse, 7.1 versus 13.3. If you're enrolling yourself plus your children, 5.45 versus 10.35. You plus your family is 9.65 or 16.65 or 15.65. So you can see there's quite a substantial increase to enroll in the standard PPO as you compare it to the high deductible health plan contributions. So to walk through the next couple slides, some examples of what you may incur with expenses to help you make a better decision for yourself. What I'd recommend you do as you're looking at this is think about what your expenses look like in 23, maybe also 22, and then think about what you anticipate for 2024. Do you think you're gonna have a similar year or a very different year? Maybe you have some pre-planned procedures already. And so as you're thinking through that, just maybe put a pen to pencil and to paper and figure out what might make sense for you and your family. So over here, we're showing if I am a single healthy person with minimal expenses, what I might pay if I'm enrolling in the high deductible plan versus the standard PPO plan. So assuming you're making $90,000, which is around the conference average, you'd pay $29.25 to enroll in the high deductible plan and $6,075 to be in the standard PPO. So you can see you're paying a little more than double to be in the standard PPO plan. If I'm going in for care, we have some out-of-pocket expenses kind of outlined below here. So the high deductible plan, let's assume that you have 12 medications. You have a monthly medication that costs you $15 per month. And same thing if you're in the PPO plan, $15 per month for a generic drug. So in both plans, you'd pay $180 for pharmacy throughout the year. If I'm going in for my preventive visits, there's no cost on either plan. So both plans cover your annual physical at no cost. If I'm going in though to see a primary care physician and let's say I go in 2 times a year, I might pay $110 on the high deductible plan to see a primary care physician. And that would be about $220 throughout the year. If I'm on the PPO plan and I go in for 2 visits, I'm going to pay $50. Okay. If you're going to go to see a specialist, it might be 2 or 3 times that amount on the high deductible plan. So what we're doing on the high deductible plan is we're saving money on our premiums, but I might pay a little bit more if I go in for care later throughout the year, as opposed to the standard PPO where I'm paying more up front to have a lower copay should I need to go in for care. So the standard PPO is, you could think of it as prepaying for services in a sense. On the high deductible plan, I'm going to pay $400 annually under this scenario. Under the standard PPO, I'm going to pay $230. So when I account for my employees' total cost, that is going to be my premiums plus my out-of-pocket expenses. I'm going to spend $3,325 on the high deductible plan. I'm going to spend $6,305 on the standard PPO. This is a difference of $2,980. So I'm going to save almost $3,000 this year if I go in for minimal care if I enroll in the high deductible health plan. So again, as I mentioned before, you could look at your explanation of benefits that you've had from 2023, and you actually see what the rates are, what the carrier, what your TPA, Boone Chapman, has paid on your behalf from the health plan. And you can actually start to get an idea of what costs you might incur on a go-forward basis. For our next plan, our next page, excuse me, this is accounting if I'm enrolling myself plus my family and I reach the maximum out-of-pocket expense limits on either plan. So on a family plan, again, assuming a $9,000 salary, I'm going to pay $86.85 in premiums for 2024 under the high deductible plan. For the standard PPO, I'll spend $14,085. So I'm spending quite a bit more money to enroll in the standard PPO plan. Both plans have a medical out-of-pocket maximum of $10,000. The high deductible plan's pharmacy out-of-pocket is included in the medical $10,000. The pharmacy out-of-pocket is in addition to what we have on the medical plan. So my total max out-of-pocket, let's say, we have 6 surgeries, maybe somebody has an accident and goes to the emergency room, whatever it might be. My worst case scenario for the year is $10,000 under the high deductible plan. Under the standard PPO, my maximum out-of-pocket worst case scenario and out-of-pocket expenses is $12,000. When you account for the premiums, $86.50 plus my out-of-pocket max, that gets me to a total of $18,685 is your worst case scenario, assuming you're at this $90,000 salary. Under the standard PPO, I'm going to have $14,085 plus my $12,000. That gets me to $26,000 annually. So you'd have an additional $7,400 if you were enrolled in the standard PPO as your worst case scenario. Now, something really important to understand that we've not noted on these tables is the Methodist non-collection agreement does not apply to the high deductible plan. The reason for that is the IRS has rules that say if you're enrolled in a high deductible plan, you have to hit the minimum deductible out of your own pocket before the plan pays. So if you're enrolled in the high deductible plan, the Methodist write-off or the Methodist non-collection agreement does not apply under the HDHP. It would apply to the standard PPO. And as you may have heard from Marianella last week on the open enrollment webinar, is if you're enrolling in the standard PPO, you do get that Methodist write-off, but it's only going to apply when you go to Methodist facilities. So something for you to also keep in mind is if you're going into Methodist versus not going into Methodist, how that might affect your decision. And as we wrap up here, that's really all the slides we have here today. I want to look over and look at the Q&A and anything else we have in the chat to see what I might be able to answer. So we will be sending out this PowerPoint. We also can post it online for those that maybe want to review the numbers on this. Have another question. So we have somebody here asking about my husband has Medicare. Does this mean that he is not qualified for an HSA, or does this mean that neither one of us are eligible for an HSA? Very good question. So I'll do my best to answer it in generalities. I cannot speak to you specifically on your situation. So if you are what is referred to as entitled to Medicare, which is really meaning you're enrolled in Medicare, you can enroll in a high deductible plan, but you cannot contribute to a health savings account. Okay, I'll say that again. If you are entitled to Medicare, meaning you're receiving Medicare benefits, you can enroll in the high deductible plan, but you cannot add money to a health savings account. Okay, so make sure that we have a very clear distinction between the high deductible and the HSA, which I believe you do from your question here. But I want to make sure that you understand there's a delineation of that. But if you yourself are not entitled to Medicare, and let's say you're enrolling as employee only, your husband's enrolling himself separately under Medicare, barring any other issues, you are likely okay to enroll in the high deductible plan and also contribute to an HSA if you're not receiving any Medicare benefits yourself. You would not be able to do the family contribution amount, but you could do that employee only amount most likely. If we select the high deductible plan, can we start the HSA? Will it have to be open January 1? Very good question. So you can only use your health savings account dollars for expenses that are incurred after you've opened your health savings account. So you cannot open it prior to being enrolled in your high deductible plan. So you'll need to enroll in the high deductible plan during open enrollment. You'll be eligible for that plan effective January 1st, and you can open your health savings account as soon after that as possible, barring your banking situation or system that you're looking at. So I'd encourage you to open your HSA as soon as possible, either on January 1 or shortly thereafter. You can start adding money into your HSA after you open that account. Now, one other question that this brings up that I think is relevant as well is, as I mentioned before, is the HSA is a debit account, which means you can only use money that has been deposited into the health savings account. So that's where I was mentioning earlier, some employees may choose to front-end load the HSA, so they'll put a lot of money, $1,000, $2,000, whatever it might be. If you're anticipating a lot of expenses in January, you can put all that money into your HSA. And then you can use your debit card from your HSA bank to actually pay for those along the way. If you don't have money in your HSA and you do have expenses, you could use maybe what is in your HSA, or you could write a check out of your checking account as your general assets. And then you just adjudicate that on your taxes later on in the year. You have to do a little bit more paperwork if you haven't deposited some things in your HSA. I hope that answers that question on that. When you hit your out-of-pocket max on the high deductible plan, Does coinsurance kick in, or does it go full coverage for all expenses and hospitalizations? Very good question as well. So let me escape out of my PowerPoint. Let's see if we are sharing here. So you guys should be able to see. Marina, are you seeing the correct screen here?
We can see it, Ryan. It's small print though, if there's a way to enlarge it a little bit, but we see the high deductible HSA.
Okay, the HSA packet. So on your website with the TAC, you have a lot of information included in here about all of your plan designs. Number 11 here is a flyer about your high deductible plan and your HSAs. So this is also included in the packet that you should have received in the mail, which summarizes a lot of what I covered here today. One of the other things in your clergy packet actually outlines how your benefits work between the two different plans. So under the high deductible plan, the question was about coinsurance and how that works. So you have an $1,850 deductible on the high deductible plan, and then you have 20% coinsurance. So what that means is if you had let's say it's a $20,000 bill, you would first, and it's an inpatient surgery. You'd first pay the $1,850, and then you're going to pay 20% of the remaining bill until you reach a maximum out of pocket of $4,500. After you hit your maximum out of pocket, you are done for the year. So your maximum total out of pocket is $4,500, and you're completely done for the rest of the year for all qualified in-network expenses. Under the standard PPO, you'd have $1,000 deductible, then you have a 20% coinsurance, which means you pay 20% of the remaining bill after your deductible until you have a maximum medical out of pocket of $4,500 and a total maximum out of pocket, including your pharmacy, of $6,500. So I hope that answers the question we had about maximum out of pockets. If not, please resubmit a question. So question, if my wife and I are on separate HSA, so separate qualified high deductible plans, I'm assuming is what the question is. So at two different employers, are we able to have one account, or will we have to have two? And you're saying you're finding conflicting opinions. I think it's going to come into how you're filing your taxes is a key piece. So I can't give you specific tax advice on your situation. I have seen where you might keep it separate because you might have another employer that's doing payroll deductions, and you have to open your account at that particular place. And if you're not enrolled in that person's high deductible plan, that other employer's high deductible plan, they're not going to allow your wife maybe to make a full family deposit over there. So it's something important it's going to be based off of your situation. And also, there's some nuances of if you're enrolling kids or not, and what plan they're in. But there's not really, I don't believe, a law against it. It's maybe practical application of how that works. But then more of how you're filing your taxes, how you're doing your banking as a family is actually more important than restrictions from an HSA. Are pre-existing conditions covered under both plans? Yes. Quick, short answer on that. And again, both plans cover the same conditions, same network. If I'm a vet and receive benefits and a spouse is not, can I do a savings for them? So if you're a vet and you're receiving benefits through the VA, that was one of the disqualifying pieces for the HSA. You can enroll in the high deductible plan. Now, whether or not you could do the savings account for your family, again, depends on the tax situation for how you're doing your taxes. So that would be a really good question for you to ask your CPA or do some individual research. Unfortunately, I can't give you tax advice about your situation. I can kind of give you some general outlines and guidance on that. If my husband, a clergy, is over 55 and I, the spouse, are both over 55, do we both get the $1,000? Good question. Quick answer, yes. So if you're both enrolled and you're both over 55, you can both get that $1,000 additional allotment. In the past, we were encouraged to use Methodist facilities. In the beginning of the presentation, you mentioned having access to UHC facilities. Can you explain this difference? So let me go back to that slide and I'll bring it up here for us. So what I'd mentioned before is if you are enrolled in the TAC plan and you enroll in the high default plan, you get access to United Healthcare's network discounts. Okay. You have the option to go to any provider out there. You have discounts if you go to one that has contracted with United Healthcare. In addition to that, with the TAC, we actually have a deal with Methodist where we have a different fee agreement. So if you go into a Methodist facility and you're a TAC member, then you will not pay the facility charges. So there's what they call a non-collection agreement where they're waiving the deductible and coinsurance if you're enrolled in the copay plan or the standard PPO plan. If you're enrolled in the high deductible plan, you can still go to Methodist, but we cannot impose the deductible waiver. That would then make you ineligible for the health savings account additions. That brings me to a question and thought really is, let's say I want to go into the HSA this year, the high deductible plan and the HSA this year. And then in 25, I want to change my mind. What happens to that money? As I mentioned before, that money is always your money. You can use it for your expenses in 2025, 2026 for copays or wherever you might incur expenses. You would not be able to add money to it if you're not enrolled in a high deductible plan, but you're never going to forfeit those dollars. So I think I answered that question. Do I have to reimburse medical expenses from my HSA in the same year in which they are incurred, or can I reimburse an expense from 2 years ago, for example, as long as I had the HSA at the time I incurred? So potentially a complex question. I'll do my best to try to answer it without knowing your specific situation. So in order to use your HSA to pay for an expense, it needs to be something that was incurred while you were enrolled in a high deductible health plan. So I hope that answers that properly. Let me reread the question and see if I'm missing something. And TAC team or Carrie, if you're interpreting it differently than I am, feel free to chime in and address that. I'm assuming the question would be, maybe I didn't have money in my HSA in 2024. It was open, but not quite open, or not quite enough funds. Therefore, I didn't pay it, but somehow it didn't go to collections. I don't know how that would really happen. I don't think you'd have a bill that lingered for a couple of years. So I'm not really sure how practical that would actually work. Essentially, you're using your HSA for expenses that are incurred while you're in that high deductible plan. If you move from a high deductible plan in 2025 to a copay plan and you still have money in your HSA, you cannot continue to add to that HSA, but you could draw down those funds in your HSA for your copays in 25 if, let's say, you went to a copay plan. As someone who sees multiple doctors a month and has a large number of prescriptions with the high deductible, this means I will be paying much more out of pocket at the beginning of the year. Correct, is the question. So good question. It depends on what your prescription drugs look like, but potentially you could incur more expenses in January or February. You have under your standard PPO, you have an individual deductible of $50, and then you'll have your costs are 20% of coinsurance after that deductible. So it depends on the size of your prescriptions. But if you have, let's say you have a prescription drug that's $400 or $2,000 even, under the high deductible plan, you'd pay that up front. So you might actually meet your deductible, you might meet your whole out-of-pocket cost in January, February, maybe through March, and then you'd be done for the rest of the year. So yes, there is potential for you to front end pay a lot more under the high deductible plan. But one thing of note, just kind of keep in mind, is you also have a very different cost structure. So you actually be saving money in your payroll deductions. So your payroll deductions that you are saving, you could actually use that money to fund more money into your health savings account up front. And that's maybe where you might want to front end load some HSA dollars. Does the HSA allow for supplements that a doctor might recommend? They need to be prescribed. So it may not, it can cover over-the-counter drugs as long as they've been prescribed. But if it's a supplement that is just an idea or a recommendation that you might want to try, but it's not, you don't actually have a prescription for it, I believe that would not fall as a qualifying health savings account expense. Again, depending on what it is, you might want to do some research on your own. Did I have somebody chime in? Robert, was it you a moment ago?
It was me. I was just going to mention that the screen is kind of small for what you're showing on the screen. But I think we have copies of that in our packet, so we could go and look at it in our packet.
Yeah, thank you. So I was showing in your packet the difference of the high deductible versus standard PPO, your deductibles and the co-insurance, as well as we were mentioning a little bit earlier, and then how the out-of-pocket maxes compare across the two plans. You mentioned that the high deductible plan is being discounted this year. Do you anticipate the discounted rate for the high deductible plan going away next year, or is that beyond the scope of today's discussion? Good question. Robert, Mark, would you all like to field that question? As they're looking for the unmute button and looking at that question, I can tell you that in the discussions with the board, there is an understanding that people in a high deductible plan often can be better consumers, and so we've been wanting to continue to keep or encourage enrollment in that plan.
Yeah, the comment I would add, Ryan, to that question is, do we anticipate that the discounted rate for the high deductible plan will be in existence next year or the year after? We do anticipate there always be a lower premium associated with a high deductible health plan, because as Ryan alluded to, the idea is that under a high deductible health plan, you, the individual, become a better consumer of healthcare choices, right, with a higher deductible and so forth, along with the HSA. So we do envision that it will be less expensive in terms of monthly premiums to be in the high deductible health plan for the various coverage levels, but we can't guarantee that the rates that you see effective for 24 will be still the same rates in effect in subsequent years.
Thank you, Mark. And looks like we've closed out all of the questions that we had on the submitted here online. We'll give a few more minutes in case anybody has anything else that they want to ask, or if something was not answered completely and you have some follow-up questions, feel free to add that in here. Again, this is effective January 1st. So your open enrollment period starts tomorrow. So happy Halloween to everybody today. Today is the October 31st, and your open enrollment does start tomorrow and goes for 2 weeks. So you have an opportunity to make all of your elections starting tomorrow, and your elections will go into effect January 1st, 2024. And if you want to get some more information about the plans, we have a new program that we're putting in place with Apta Health next year that I think you guys will all be really happy with. It's going to provide a lot more hand-holding and higher touch service. There's a lot of information that was presented last week on the webinar that's already posted on the TAC website that you can go back and watch and listen to if you didn't have a chance to join last week. Don't see any more questions coming in. Anything else to wrap up here, Robert or Marinelle or Mark?
I think we're good. I will say to everyone that when you consider the PPO plan and the high deductible plan, and you compare the PPO plan, non-Methodist hospital and Methodist hospital with the write-off, and you consider the premiums paid throughout the year between the three options, between the high deductible with those premiums, the PPO with the premiums, plus using Methodist hospital write-off or using a non-Methodist hospital, when you compare all three at the end of the year, the high deductible, regardless of the expenses for the year at the hospital, those costs are always cheaper at the end of the year because the premiums are less than the standard PPO. And so we have some examples in the conference office of your salary being at 50,000 a year or 75 or 90 or 100,000 a year. And so looking at the examples of different hospital procedures, like someone having a baby or someone's diabetes or a heart surgery or some examples, and how that would play itself out for the upfront cost at the hospital and out of pocket and prescription coverage and so forth, and how that relates to your premiums through the year in all three plans, meaning not three plans, but the high deductible and the PPO, and in the PPO using non-Methodist and using Methodist. And so feel free to reach out to us and we can walk that through with you. Just know that November 15th is the deadline to submit if you want to make a change in your plan. Yes, well, thank you, Ryan and your team from Alira, and Marianella and Mark and Patricia for being here as well. And there's our contact information. Feel free to reach out to any of us. If you have any questions, we'll be glad to sit down with you and to walk through your particular situation that you would like to kind of present a plan for 2024 and what would work best for you. So thanks, everyone. Have a great afternoon.